Iconic dental exists because some patients need a completely different kind of care than what a typical dental practice can offer. Here at Iconic, I really chose to tailor our treatment plans for patients that have been left in the dark in a typical dental office, and that's coming with patients with extreme high anxiety, very medically complex, and this can be a plethora of different reasons, whether it was trauma at a young age and there's fear built around the dental office, whether it's medically complex with persons with disabilities, if it's drug abuse and recovering addicts. We want to be able to cater to those needs, and all of that it takes is not changing the scope of dentistry, but changing how much time we spend with those patients to take them from step 1 to step 100 and really cater that dental treatment to that patient. My approach here at Iconic and what this office has really been built around is making sure that we slow things down. We are not a high volume office in terms of how many patients we see within a day. We're a high volume of care for that each individual. So that means coordinating all of our care with primary care physicians, cardiologists, pulmonologists, whatever dental team that we need to create for that patient to feel comfortable. That's really what's necessary for us to remove any pressures for that patient to stepping foot into a dental office. When patients leave Iconic Dental, I really want them to feel that they found their new dental home. So getting into the door is the very first step, right? And it's breaking that psyche so the patient starts to develop the rapport with the dental team. And when they leave that office, they know that we're taking the time that they need in the dental chair before we even talk about the dental procedures that we can perform. We really want to provide expert level care, and so those patients feel confident when they leave our practice and they know that this is an office they need to be a part of. The biggest portion in our office that we always tell the patients to take home is, even though today was hard, the next appointment's easier, and from 1, 2, 3 visits later on, we start talking about not how the patient has anxiety, but how they like to come to the office because they've retrained that psyche to enjoy being in the dental chair.